Hello, and welcome to the Senior Care channel here on Roku TV. My name is George Roach. I'm an elder law and estate planning attorney with over 30 years experience in this field. Thank you for tuning in today. Today's topic, sort of as a follow-up, we talked about Medicaid in a previous program, but I'd like to talk about another topic, quite a similar name, Medicare. All right, Medicare. People probably have a lot of questions about the Medicare coverage and what the program is. And it's sometimes I say over the years, it's a shame the two words are so close together. Medicare and Medicaid. People say one when they mean the other and vice versa. Medicaid, as we spoke in a previous program, is a needs-based program. You have to be considered poor enough to qualify for it. And Medicaid covers not only acute care, where something is actually wrong with you, if you're eligible, but it also covers custodial care. And that's a big distinction between Medicare and Medicaid in the area of custodial care. When we say custodial care, I mean things that people need to maintain themselves. In the elder law field, we call them the activities of daily living. All right, what are they? The activities of daily living, or ADL skills as we call them, are the things we all take for granted because we're healthy. We didn't give them a thought this morning. They are the ability to dress yourself, feed yourself, toilet yourself, bathing and washing, and what we call transference, mobility, getting up and out of a chair, in and out of a car. All those things we take for granted because we're healthy. All of a sudden you take a fall and break a hip, or you have a partial or full stroke, fall down a flight of stairs, you come down with dementia and Alzheimer's disease, you forget how to dress yourself, wash yourself, feed yourself. If you're at home alone, you're at risk because you can't perform these activities of daily living anymore. And Medicaid provides for that. That's considered custodial care, care that helps you maintain yourself, not care where there's something actually medically wrong with you. You had a heart attack, you had a kidney failure, you had a stent put in, you broke an arm, something that required your actual hospitalization. And when we talk about the Medicare program, all right, Medicare program, that's the hat you have to put on. You have to put on your insurance hat. Medicare is an insurance program. That's the bottom line. It's an insurance program. And anytime you have an insurance program, all right, there are four things you really have to remember, all right, with any insurance policy. Number one, there are premiums. This stuff costs you, all right? You have to pay for it. They're not giving it away because you're poor enough, all right? So number one, premiums. Number two, deductibles. A little topic called deductibles. What's a deductible? Very simply, all right? When this program starts to pay, you have to pay first. Money out of your pocket. That's called a deductible, all right? And we have premiums, we have deductibles. Then what do we have? A thing called co-pays. Co-pays, which means the program, the insurance program, will pay for a certain period of time, after which you have to start kicking in. So there's a copay, and those copays are going up all the time. Medicare, as a general rule, usually pays 80% of the cost of a procedure, and you're on the hook for the other 20%. The other 20% is considered your copay, and we'll deal with that in a little bit. Now, the last thing, so there were premiums, deductibles, copays, and lastly are exclusions from coverage. As we say, the devil is in the details. Insurance companies, no matter who they are, Medicare included, spend millions of their dollars advertising what they cover. That's wonderful. Tell me what you don't cover. Exclusions from coverage. what's not covered, because dollars to donuts, 9 times out of 10, you have Medicare coverage, you're going to run across a situation that was excluded from coverage and you didn't know about it till it's too late. And now the hospital and the doctor have already rendered those services to you, and I used to see this many, many times at Legal Aid. Medicare says, we're not covering it, so who's on the hook for the bill? You are. And then you winds up getting sent out for collection. It's just a horrible, horrible situation. So you got to be aware of these exclusions from coverage. All right? And when I teach my elder law class at the law school at St. John's University School of Law, we spend a couple of classes on Medicare coverage. So it's up to you to Medicare.gov. Matter of fact, that's the official website, Medicare.gov. If you have access to a computer, you want to be able to get that information from the computer. All right? But remember, Medicare is an insurance program, first and foremost. Now, don't forget, it started, I can remember, back in 1965 with Lyndon Johnson. President Lyndon Johnson passed these great society programs that everybody seemed to rail against, including my parents. And one of those programs was Medicare in 1965. I remember my parents saying it's going to be socialized medicine. Well, today, many, many senior citizens rely on the Medicare program. Matter of fact, we just, I don't know if it's a scare tactic, but there was an article in a local paper yesterday, Newsday, and it said that Social Security is going to run out of money by 2026, and that Medicare will run out of money by 2033. In any case, they need to do something. Congress needs to do something, and the problem really is Congress never acts unless there's a crisis. So when that crisis gets down the road, I suppose they'll act. But until then, what you need to know about the Medicare very simply is Medicare starts out very simple. All right, there are several parts to it. First we have Part A. First of all, before we start with the parts, who gets Medicare? All right. A lot of times I see senior citizens are upset about the fact they call Social Security and Medicare an entitlement program, because your money paid for it. I'm entitled to it. You're entitled to it by virtue of your age. Who gets Medicare? People who are age 65, blind, or disabled. Those are the types of people who get Medicare. Now, age 65 is the most common. You reach age 65, you get Medicare, and you file for it. Now, a couple of things you got to be aware of. If you're age 65 and you are still working, you are still employed, all right? Your group, if you're lucky enough to have group insurance coverage through your employer, even though you're over 65, your group coverage is your primary medical coverage. It's not until you retire from that job will Medicare become your primary, and hopefully your employer insurance, if you can maintain it, will become your secondary, will be the copay. All right, we'll cover those copays hopefully later on down the road. But age 65. Now, in my case, my full retirement age is 66. All right, so I can get my full retirement Social Security at 66, but I'm eligible at age 65. All right, and eligibility becomes an important factor when you're looking at Medicare coverage, because the last thing you want to be is be out there without any kind of medical coverage. So age 65, blind, or disabled. Now, disabled people who get Social Security disability, another government program, whereby if you have at least 40 quarters, that's 10 years of a work record, you paid into the Social Security system for 10 years, and you become disabled, something happens on the job, a fall, an accident, you name it, where you can no longer continue to work, you may be eligible for Social Security disability. And by the way, there's a whole specialty of lawyers, disability lawyers, who handle these types of cases. And my advice to you, if you're listening this afternoon, you're listening, very simply is, do not try to file for Social Security disability on your own. Get a good local Social Security disability lawyer. Again, Try your local bar association. All right? Let them handle it from the start. Many times over the years I've seen a person wants to file for Social Security disability, goes to their doctor, the doctor rips a piece of letterhead off his pad and says, to whom it may concern, this person is disabled, Dr. So-and-so. All right? That's not going to cut it. You need some pretty extensive medical evaluation and reports, and the attorneys know how to put them together. And by the way, the disability attorney is paid for by, he or she gets an award from the Social Security Administration. Usually it's about 25% of what you recover. So there shouldn't be any upfront costs in handling a Social Security disability case other than getting the reports themselves. But if you're eligible for Social Security disability, let's say you're 47 years old, you had a heart attack on the job, you can no longer work. Very simply, you file for Social Security disability. What's the standard? The standard is you must be totally, permanently disabled. What does that mean? It means that you can no longer engage in any substantial gainful activity. Not that you can't go back to your old job. All right? Kind of a pretty strict standard, depending on the severity of your medical condition. But if you cannot engage in any substantial gainful activity, your Social Security disability award should be granted. Once that award is granted, based on your work record, your 10 years worth of work, you earned it. All right? You put the money into the system, you earned it. That Social Security disability award is tax-free. All right? It's tax-free. Now, let's say you're declared disabled at age 47. Normally, you must wait at least 2 years from your disability award before they will enroll you in the Medicare program. So that's the only hitch with disabled people. You have to wait, you have to collect 2 years worth of checks before you're eligible for Medicare. All right? And there are two exceptions to that. I believe one happens to be a terminal illness, and the other one happens to be end-stage renal failure. The kidneys are on their way out. Then they will enroll you automatically into this Medicare program within a short time, because you're not going to be around 2 years from now to get those benefits. But most people on Social Security disability have to collect 2 years worth of checks. So the question for you is, what's my medical coverage during those 2 years? And sometimes it's eligibility for Medicaid because you're in the community. All right? And we talked about that in a previous program, the eligibility requirements for community Medicaid. So you can get Social Security disability and get Medicaid pending the 2-year wait until you enrolled in Medicare. So that's why we say age 65, blind or disabled at any age. Okay? There you go. Those are the people who get Social Security disability and Medicare. Now, the Medicare, several parts to it. They like to do it alphabetically, A, B, C, and D. All right? Sounds pretty simple until you start to get into the parts. A is your hospital coverage. And if you look at the requirements, I'm not going to list them here, the days you're covered in the hospital, the co-pays, the premiums. And by the way, nobody pays a premium for Part A. All right? But there are deductibles. Everybody who turns 65 and is eligible for Medicare gets Part A. All right? So you at least have hospital coverage. Now, Part B is everything else, as I like to consider it. Doctors, lab tests, blood tests, you name it. All right? Screenings, and everything but hospital coverage is covered under Part B. And again, 80% is picked up by Medicare, and this is the catch. 80%, what Medicare covers is 80% of the, quote, reasonable charge for the service that's rendered. 80% of the reasonable charge. And many times, especially here in New York, with the high price of medicine, what your doctor is billing for this procedure and what Medicare says is reasonable are worlds apart. All right? So that can be a big 20%. 80% of the reasonable charge, Medicare says, we're not paying the full bill. We're going to pay 80% of what we say is reasonable, and you're on the hook for the rest. All right? And that can be the other 20% or more, depending on what the doctor has billed. So what kind of coverage is available? it is important, if you're relying on Medicare as your primary source of medical coverage, that you have to go out and purchase what they call a supplemental Medicare policy, or what they call a Medigap policy, to pick up that 20%. Many policies pick up some or all of it. You got to try to reduce as much of it as you can. All right. Just to give you an example, if you need a nursing home here in the state of New York, all right, under Medicare, you are entitled to a maximum of 100 days coverage in a nursing home under the Medicare program. Now, 100 days to you and I, it's a little over 3 months, okay, coverage. Now, there's a breakdown in those days. First of all, you have to spend at least 3 days in a hospital before you get transferred to a nursing home for rehabilitation, all right? Rehab, subacute care, we call it. So you're in the nursing home now. After you're 3 days in the hospital, you're entitled to the maximum of 100 days, and there's a breakdown in those days. Days 1 through 20, the first 20 days in that nursing home, are fully paid for by Medicare. Not a dime comes out of the patient's pocket. Okay, Medicare is an insurance program. We mentioned copays. All right? What happens on day 21? On day 21, for those next 80 days, the copay, the money you have to shell out, is $148 per day. You're on the hook for $148 a day in that nursing home through day 100. Now you take $148 a day, it's not rocket science, and you times it by 80, will give you over $11,000 that you're on the hook for in just 3 months. So the question becomes, you better go out and get a good Medigap policy, a supplemental Medicare policy. And they market them out there. There are several different ones. I know the and this is not a plug, the AARP, the American Association of Retired Persons, I believe through United Healthcare, has about 12 different levels of supplemental Medicare coverage that you can purchase. And some of them cover copays, deductibles, and the big thing is the copay. You want to make sure you get a policy you can afford, and you're going to have to pay a premium for it. So you're paying a premium not only for the Part B Medicare, but you're paying a premium for the supplemental policy. And then we go on to Part D, as in dog. All right. Now, originally when Medicare was founded and created back in 1965, there were no prescription drug coverage under the Medicare program. And over the years, government has tried to provide that program, and of course the problem always became the funding source. Medicare is a societal program. You spread the wealth around to everybody. You just can't bill the senior citizens for it. And that's what they tried to do back in the mid-'80s. They tried to expand the Medicare program to provide prescription drug coverage, but wanted the senior citizens to foot the bill rather than everybody else. So, as you can imagine, it didn't fly. Well, we now have prescription drug coverage. Part D is the prescription drug plan under Medicare. And again, you have to go out and find a plan that fits your budget, especially senior citizens who are taking multiple medications. All right? They're called your formulary. Usually the best advice I gave people in this area was, if you're picking a program, a lot of the major drugstore chains that we have, they're all geared up for it. They have programs. You go in, speak to the pharmacist, you give him a list of all the drugs you take, generic versus brand name. He'll plug it into the program they have, and they'll come out with the various programs. I think here in New York, multiple programs that we have, and it can get quite confusing. So it's, again, as a senior citizen, it's up to you to be consumer conscious and what will fit your budget and cover your drug needs. And again, you have to work with your doctor. If the generic doesn't work for you, and you want the brand name, sometimes that's a real issue. The program won't cover a brand name when a generic is available. Has to be a medically necessary reason for it. That's the key with Medicare. Something has to be medically necessary, as prescribed by the doctor. Now, there is a Part C, And Part C is for those people who want to sort of opt out and get everything all in one program. They call it the MAP, M-A-P, the Medicare Advantage plans. And they're sort of like Cadillac programs where you could get A, B, and prescription drug coverage, D, all rolled into one. The only catch with these MAP programs that was a little difficult for people was part of the deal was you had to use their facilities, their doctors. You had to use the people on their list of providers. You had to stay in their network. God forbid you got sick and got treated out of network somewhere in other than an emergency situation. It became very difficult to get the coverage. So those plans, and again, they were private insurance company plans. And anytime you're dealing with private insurance, it's always the bottom line. All right? If they decided it wasn't for them and they weren't making a profit, they simply opted out of the program and left those poor people holding the bag. It was a shame, but that's the capitalist system. That's the profit system. All right? But traditional Medicare, A, B, get a supplemental policy and a prescription drug policy, and make sure it fits in your budget, and that's about the best you can do. All right? If you're still working, your employer becomes your primary, and Medicare is really, once you retire, Medicare becomes your primary, and then the employer, if it's available to you, will wrap around and become your secondary, and you may not need a supplemental policy. Okay? So that's a little bit about Medicare today, and hopefully you will find it helpful. Thank you.